Imagine you are standing in front of your bathroom mirror tonight, just as you do every evening before bed. You are finishing your routine, but as you rinse, you notice a small, faint trace of pink in the sink. Most people your age simply shrug it off, thinking they brushed a little too hard or that it is just a natural part of getting older. You might even tell yourself that your gums are simply becoming more sensitive with the passing years. But what if that tiny drop of blood was actually a direct, urgent message from your heart? In my clinical practice, I often meet patients over 60 who describe bleeding gums as a minor nuisance, almost like a gray hair or a new wrinkle. However, after decades of observing how the human body ages, I have learned that the mouth is never truly isolated from the rest of the system. That persistent redness or occasional bleeding is not just a local mechanical problem. It is often a silent, early signal that something deeper is shifting within your internal environment. It is a window into the health of your blood vessels and your immune system's current state of alert. When we pass the age of 60, our body's ability to repair itself changes, and what used to be a simple irritation can now point toward chronic inflammation that is quietly stressing your entire cardiovascular system. This subtle sign often coincides with the way your body responds to blood pressure medications or hidden nutrient gaps that do not show up on standard tests. We are beginning to understand that there is a precise, medically grounded reason why your body chooses this specific signal to warn you about risks that are still invisible on the surface. In the next few minutes, we are going to look beyond the surface of your smile to understand why that tiny trace of blood is actually a vital diagnostic tool. I am going to reveal how a condition that many dismiss as a simple sign of aging is actually a clear window into your internal health, specifically the strength of your blood vessels and the quiet activity of your immune system. You will discover why your body uses this specific signal to tell you that its natural repair mechanisms are struggling, and more importantly, how this relates to the way your heart handles pressure every single day. We are going to explore the concept of a constant, low-level irritation within the body, what we often call chronic systemic inflammation, and how it acts as a hidden weight on your cardiovascular system. This isn't just about oral hygiene. It is about how certain medications or missing nutrients can leave your tissues vulnerable, turning a routine morning habit into a warning light for your overall longevity. By the time we finish, you will understand the direct link between the health of your mouth and the hidden processes that govern your circulation, allowing you to take control before these silent changes lead to more serious concerns. But even as we discuss these biological signals, there is a second factor, an even more surprising detail that I have found to be a major missing piece of the puzzle for my patients over 60. It involves a common nighttime pattern that almost everyone ignores, yet it has a profound impact on how your body regulates inflammation while you sleep. Most people are completely unaware that this one specific habit is quietly undermining their heart health, and we will uncover exactly what that is and how it ties everything together in just a moment. Most of us have a very specific habit when we see that trace of pink. We immediately blame the toothbrush. We tell ourselves the bristles were too stiff, or we were simply in too much of a hurry. But in reality, the first major error many people over 60 make is treating the mouth as if it were a separate part of the body, disconnected from the heart and the arteries. We focus so much on the mechanical action of cleaning that we miss the actual condition of the tissue itself, which is often trying to signal a state of vascular fragility that becomes much more pronounced during the night. The concrete factor we are looking at here is a category called systemic vascular permeability, which essentially means your blood vessels are becoming overly sensitive or fragile. This often shows up first in the gums because they are filled with tiny vessels and covered by very thin skin. If you notice this bleeding, especially after a long day or right before bed, it may be a sign that your body's internal inflammatory levels are rising. This isn't just about dental hygiene. It is a reflection of how your internal lining is coping with the pressure of your circulation, particularly if you are already taking certain common medications for your heart. If you want to better understand these silent signals that the body sends during the night, you can follow me on this channel. While the bleeding might seem like a small, isolated event, it is often the first domino in a much larger chain reaction involving your immune system's nighttime repair cycle. But there is a very specific reason why this signal becomes so much more dangerous if it is accompanied by one other subtle change in your nighttime breathing. We are about to uncover how a hidden pattern in your sleep is actually the catalyst that turns this minor irritation into a significant cardiovascular risk. Imagine your blood vessels are like the delicate lining of a silk suit. In your youth, this fabric is tight and strong, but as we cross 60, that fabric can start to thin, leading to what we call vascular permeability. This is essentially a state where the walls of your smallest vessels become slightly leaky or fragile, allowing tiny amounts of blood to escape under pressure. It is a visible demonstration of how the lining of your circulatory system is coping with the hidden demands of your heart. Many people accept this bleeding as a standard part of getting older, like a stiff joint. But your gums are the only place where your internal blood vessels are covered by such a thin layer of skin. When they bleed, you are seeing a real-time report on your internal inflammation, a process where the body stays in a state of high alert that can eventually tire out the heart. A symptom you thought was just a dental issue is actually a vital early warning system for your arteries. But here is where the situation starts to take a turn that most of my patients never see coming. You might think that simply switching to a softer brush is the end of the story. In reality, focusing only on the surface is a common mistake that ignores a hidden process putting a constant, invisible strain on your heart while you sleep. There is a persistent myth that this redness is just an inevitable part of getting older, but the truth is much more revealing. There is another detail, a specific evening habit that almost no one connects with this redness. It is a silent consequence that bridges the gap between a simple dental visit and a serious heart checkup. I remember a patient who was convinced he was doing everything right, only to discover his routine was masking a signal his body had been screaming for months. What we uncovered in his case was truly eye-opening, and it proves that your body is always trying to tell a story. I recently saw a patient, a gentleman in his late 60s, who came to see me for a routine cardiovascular assessment. During our conversation, almost as an afterthought, he mentioned that he had started seeing blood in the sink every morning. He laughed it off, telling me he simply needed a softer brush, or perhaps he was just getting older. But as a physician, I saw something else, a subtle, persistent leak in his body's primary defense system that was signaling a much deeper issue. When we looked closer at his history, we found he was meticulously following his blood pressure regimen, yet his body remained in a state of quiet, chronic alert. This wasn't just about his mouth. The inflammation in his gums was a mirror image of what was happening inside his arteries. We discovered that his standard medications were interacting with a hidden micronutrient gap, making his smallest blood vessels significantly more fragile. His gums weren't just aging. They were struggling to maintain their structural integrity under the weight of systemic stress. The most surprising detail was that this bleeding only occurred during his morning routine, never during the day. This specific timing told us that his vascular system was failing to stabilize during the natural fluctuations of his nighttime sleep cycle. It was a clear clinical sign that his internal repair mechanisms were being overwhelmed by a low-level inflammation he hadn't even noticed. By addressing this minor dental symptom as a serious cardiovascular warning, we were able to adjust his routine and significantly improve his overall circulatory health. You might feel exactly like this patient, wondering if these small changes are even worth mentioning to your doctor. In my experience, those who listen to these quiet messages from their body are the ones who stay healthy and independent the longest. It is not about fear, but about having the wisdom to recognize when your internal environment needs a little extra support. This connection between your oral health and your heart is one of the most powerful tools we have for early prevention and long-term vitality. Now that we understand how this trace of blood reflects the state of your internal fabric, it is crucial to address the common mistakes that accidentally make this fragility much worse. Many people, out of a genuine desire to be healthy, respond to seeing blood by brushing even more vigorously. They believe that by scrubbing harder, they are removing the bacteria causing the problem. In reality, this mechanical aggression on already thinned vascular walls is like rubbing sandpaper on fine silk, turning a minor internal signal into a chronic injury. Another very frequent error involves the use of strong alcohol-based mouthwashes that promise to kill nearly all germs. While the intention is to sanitize, these aggressive liquids often strip away the natural protective moisture of your oral cavity, leaving the tissues dry and irritated. For someone over 60 whose tissues already have a reduced capacity for repair, this chemical drying effect can actually increase the permeability of those tiny blood vessels. You might think you are sterilizing the area, but you could be inadvertently weakening your body's first line of defense. There is also a hidden nighttime pattern that many of my patients overlook: the issue of mouth breathing while you sleep. When you breathe through your mouth all night, the delicate tissues become incredibly dry and brittle by morning. When you finally go to brush your teeth, that parched skin is far more likely to crack and bleed at the slightest touch. Most people blame their toothbrush for the morning blood, never realizing that the real culprit is the lack of nighttime humidity and the way their body is processing oxygen during the hours of rest. Finally, I often see patients who take various heart-healthy supplements, like high doses of vitamin E or certain herbal extracts, believing they are supporting their longevity. While these can be beneficial, they can sometimes have a mild blood-thinning effect that, when combined with your prescribed medications, makes your gums appear much more sensitive than they actually are. This is a perfect example of how a well-intentioned habit can mask a deeper vascular message, leading you to ignore a signal that your circulatory system is under unnecessary pressure. Now that we have identified the message behind that trace of pink in the sink, you might begin to notice other subtle hints your body is dropping throughout the day. Have you ever woken up feeling a strange heaviness in your legs? Or perhaps notice that your favorite shoes feel just a bit tighter by the late afternoon? This mild swelling, often dismissed as a simple result of standing too long, can actually be another branch of the same vascular story your gums are trying to tell. It is often accompanied by a faint sense of mental fog or a tiredness that lingers even after a full night of rest. These small discomforts, such as feeling an unusual chill in your feet even under warm covers, or experiencing occasional heart palpitations that seem to come out of nowhere, are frequently linked to the same internal inflammatory pattern. If you find yourself needing to catch your breath more often during a simple walk, or feel a recurring pressure in your chest that simply does not feel right, it is time to pay closer attention. While these signs can be subtle, they are your body's way of asking for a professional evaluation to ensure your circulatory system is functioning with the strength you deserve. However, it is vital to understand that while most of these signals are early warnings meant for prevention, some situations require immediate medical intervention. If you experience sudden, intense chest pain, a sharp difficulty in breathing, or if the bleeding in your mouth becomes persistent and heavy without any clear cause, please do not hesitate to seek emergency care. Taking action in these moments is not an overreaction. It is the most responsible step you can take to protect your future and your independence. Listening to your body when it shifts from a whisper to a shout is the ultimate act of self-care. Now that we understand these silent messages, we can begin with small daily adjustments that support your internal resilience and protect your vascular health. It is not about radical shifts, but about creating a more supportive environment for your body's natural repair processes. You might start by simply choosing a toothbrush with extra soft, tapered bristles and adopting a circular, massaging motion rather than a back-and-forth scrub. This gentle approach preserves the delicate lining of your gums and prevents unnecessary microtrauma to blood vessels that are already under systemic stress. There are two specific things worth remembering for your nighttime routine that can significantly change how your body recovers while you sleep. First, consider using a simple room humidifier to keep the air moist, which prevents your oral tissues from becoming brittle and prone to bleeding by morning. Second, practicing conscious nasal breathing during the day can help your body maintain this habit throughout the night. Keeping your mouth hydrated and closed during sleep is a powerful way to reduce local inflammation and ensure your circulatory system isn't fighting against avoidable dryness. When you next visit your physician, you may want to discuss 3 important areas that often go overlooked in routine checkups for those over 60. Ask about your current levels of specific micronutrients like vitamin C and bioflavonoids, which are the building blocks of strong blood vessel walls. It is also helpful to review the timing of your blood pressure medications to see if they align with your body's natural nighttime rhythms. Addressing these internal gaps through a balanced, colorful diet and professional guidance ensures that you are treating the root cause of vascular fragility rather than just the surface symptoms. Ultimately, true prevention is found in the consistency of these small, mindful habits that honor your body's changing needs. By organizing your day to include proper hydration, gentle care, and open communication with your medical team, you are actively choosing a path of autonomy and long-term well-being. These changes may seem minor, but for your heart and your arteries, they represent a significant reduction in daily stress. Remember, every time you choose a gentler approach, you are sending a message of support to the very system that keeps you moving forward with strength and vitality. Taking control of these subtle signals is one of the most significant steps you can take toward a future of true independence and vitality. By choosing to listen to what your body is whispering through your gums or your nighttime breathing, you are actively shielding your heart and your circulation from unnecessary stress. These small daily choices are not just about hygiene, they are a profound commitment to your own longevity and the quality of life you deserve as you continue to age with grace and strength. If you want to stay informed and learn more about how to recognize these silent warnings before they become serious concerns, I invite you to follow me on this channel. It is a privilege to share this journey of prevention with you and to provide the tools you need for a healthier, more vibrant life. I would also love to hear from you directly, so please write in the comments which health topic or specific concern you would like me to address in my next video.